In this video, you will see realistic situations where patients and visitors who are visually impaired are interacting with healthcare workers and volunteers. The objective of this video is to identify some of the situations that you may encounter in your job and to give you more knowledge and confidence to help the visually impaired. People with visual impairments are unique and their level of vision varies widely. In fact, 90% of persons who are legally blind still have some remaining vision. So don't assume that all persons who are visually impaired will act the same or need the same kind of help. The best thing that you can do is to ask them, "How can I help you?" Imagine being visually impaired and going to a hospital or doctor's office. Healthcare situations under normal circumstances may cause anxiety. Now, imagine being visually impaired as well. You may not be able to see where you are going, read signs, or even see people's faces. As a healthcare worker, you may see someone who is standing there, looking lost or confused. You want to help. You suspect that they are having trouble seeing, but you're not sure what you should do. Helping can be as simple as asking, "How can I help you?"
Hello,
Hi.
my name is Sue. How may I help you?
I'm here for an operation.
All right, would you like to take my arm?
Yes, I will.
All right, thank you.
Providing assistance is not difficult. There are no set ways or specific rules to follow. Through this video, you will see how easy it can be to recognize and assist someone who is visually impaired. You will understand some of the ways that you can give that assistance. Be creative and flexible. But most importantly, you will understand that the best thing that you can do is to ask, "How can I help you?" So let's start with some of the basics. There are 3 techniques that the visually impaired will use to travel: the use of the white cane, the dog guide, and sighted guide. The white cane is the universal symbol of blindness or visual impairment. In reality, only 10% of persons who are visually impaired will use a white cane. Less than 1% of people with visual impairments will travel with the assistance of a dog guide. The Americans with Disabilities Act states that healthcare facilities need to have policies in place that allow for dog guides. When you see a dog guide, there are some rules that you need to remember.
Excuse me, I know it's really tempting to pet him, but if you could not pet him, he's working for me, I can't see it all, and it would help me. Very distracting.
Never touch, distract, or hinder the work of a dog guide.
Good morning.
Good morning, how are you?
Good. My name is Bob and I'm a volunteer. May I help you?
Yes, I'm looking for outpatient services. I am obviously blind, and I'd love some directions if I could.
Okay. What you're going to do is you're going to go straight ahead and you're going to walk up a hallway and there'll be a set of elevators right there. You're going to take them to the first floor. If you would like, I'd be happy to assist you and take you up.
That'd be fantastic, actually. I'll just
Okay.
put him in a follow.
All right.
So if you walk normally, we've got it.
Very good.
Quinn, follow.
Would you like to take my arm?
Yes, I will.
Sighted guide is the most common way that persons with visual impairments will travel. Describe how doors open.
It opens away from us. The hinge is on the right.
Sighted guide means
Okay.
simply that a person with vision is leading the way. When guiding someone who is visually impaired, do just that, guide. Never grab them, but rather extend your arm and let them know it is there. Discuss where you are going, what you will encounter on the way, like steps and other obstacles. Sometimes you suspect that they are having trouble seeing, but you're not sure what you should do. If they know you are there, a person with a visual impairment, like anyone else, will ask for assistance if and when it is needed.
Hello? Could I help you?
Well, I'm blind, not deaf, so could you talk a little quieter?
Sure.
I have a sister on the second floor.
You go over there,
over there is not helpful. And people often think that they need to raise their voices, confusing hearing loss with visual impairment.
Oh, would you like me to take you over?
Oh, yeah, do you mind?
Oh, sure. Come on, this way.
And actually, I'll hold your arm.
If you think that someone is visually impaired, let them know that you are willing to help by asking them, "How can I help you?"
My name is Susan. I'm a greeter here.
Oh, hi.
You look as though you might need a little direction.
Yeah,
How can I help you?
When assisting someone who is blind or visually impaired, be specific with your directions. Use words like left or right. Use points of reference to help guide them, like the number of doors to the left or it's to the right of the stairs.
So on your right will be the nurse's station, and they can help you from there.
Okay.
How does that sound?
A little confusing.
Oh, would you like me to show you the way?
Sure. Is that too hard?
No, that's fine. Take my elbow.
Thanks.
The fact that a person has a visual impairment may not be obvious at all, and some people don't like to admit that they can't see well. Some misconceptions about people with visual impairments are that they all use white canes and wear sunglasses, or that they are helpless and don't get around very well. But the truth is that many are able to function very well independently. There is also the belief that they see just black, but less than 10% of people with visual impairments have no remaining vision. The rest have varying degrees of vision. Their vision may be cloudy or gray. They may have lost their central vision, that area that provides them the ability to read, recognize faces, or measure depth perception, such as those with macular degeneration. For many with diabetes, not only is their central vision lost, but areas of the peripheral as well. Still others may have lost their peripheral vision and only be able to see a small fraction of what is directly in front of them. Some people are born blind, some have lost their vision suddenly, but most lose their vision gradually. Over 75% of people with visual impairments are seniors. Even though many people with visual impairments may travel and live independently, still there are times when they could use and appreciate your help. People with visual impairments may need special accommodations to help them have access to printed materials.
Hattie, I have some documents for you to read today, and we have a variety of ways that you could look at them. I have a large print version and some braille. We have an audio tape of the same document, or someone could read them to you. We also have a magnifier. Which one would you prefer?
Well, I brought my magnifier. I think I'll use that.
Oh, very good.
Okay.
Here you are.
As suggested under ADA, public organizations should offer alternative formats to access information. Many formats are very easy to create and very inexpensive. Be creative and think about some of the things that you can do in your area, keeping in mind that HIPAA and privacy are also important.
Hello, Hattie. My name's Christy. I'm going to be your nurse today.
Why are you yelling at me like that?
You're not hard of hearing?
Not really.
Oh. Well, I'm going to orient you to the room today and take your vital signs.
You want me to? Well, I guess that's on and off.
There are some special considerations related to communicating with people with visual impairments. The patient might not be aware if you walk away without telling them. Be sure to orient them to their room or their surroundings, pointing out locations of importance and reviewing the operations of devices such as the remote control or call buttons. Be sure to explain things and let them know before touching them, even for vital signs.
Good morning, Hattie. My name's Christy. I'm going to be your nurse today. How are you doing this morning?
Pretty good.
I'm going to orient you to your room, okay, and let you know where things are.
All right.
All right? So when you're sitting in bed as you are on your left-hand side, there is a bedside table. On the bedside table, there is a call bell so you can get a hold of the nurse, and there is a phone. This is the call bell. Can you see the big red button on the top?
Yes.
I'm going to have you push it. And that's how you'd get that to go out to the nurse's station, so we know that we need to come in and see what you need.
You can't hear it in here, though.
No, you
No?
can't.
Okay.
All right. This is your phone. Are you able to see the numbers okay?
Yes.
Yes.
Yeah.
Okay. To get out on an outside line, there is a red button on the right-hand side of the phone, right here, and you just push that,
Oh.
and it will give you an outside line. Okay? In front of you is your bedside table. Okay, on the far
I'm now behind you here. You're going to feel me touching your back, okay?
Before and during procedures, healthcare workers need to be mindful to communicate carefully, remembering that a patient can't see what is going on.
So what we're going to do, like I said, in just a second here, I'm going to just get some cold, wet soap and just clean off your back a little bit, so you'll feel me kind of moving in this circular motion like I am right now. Once we get that, we're going to put some sterile drapes across your back, and then at that point...
Hi, Hattie. I'm Jan from Food Services, and I have your lunch tray. How can I help you with this today?
Where is it?
Oh, it's right here in front of you.
What's on it?
Okay. Well, at 6 o'clock you have a sandwich. At 7 o'clock is your silverware.
Using references such as positions on a clock are also easy ways to provide information. This technique is helpful to find something that is in front of them. It can also be used to orient them to their surroundings, both indoors and out.
And down here at 4 o'clock is some delicious looking cheesecake.
Cold out today.
Not only patients, but visitors as well may need assistance. Remember, if you are leading someone with visual impairment, offer to let that person take your arm. As you are walking together, describe the environment, including obstacles you are trying to avoid.
There's a wet floor sign here, so we're going to need to go a little to the right, and a laundry cart on our right.
Remember, if you see someone you think may need help, introduce yourself and ask, "How can I help you?"
Hi, my name is Bob, and I'm with the hospital as a volunteer.
Yep.
May I help you, or how can I help you?
Yeah, I just was wondering, could you show me some of the choices for lunch?
I'd be happy to. If you'd take my arm,
Yeah, that'd be great.
and I'm going to stop here and grab a tray.
Okay.
And the first thing we have come to is soups and salads.
Okay, that's good, actually.
Okay. Would you like a soup?
Oh, yeah.
Do you know what?
I have some instructions for you, some important things for you to know after you go home. I've got them in written form. I can read them to you.
A critical consideration for patients with visual impairments is their understanding of discharge instructions and being able to review them after they go home.
Now, I know you may not remember everything after some of the medication. I can also call you later if that would be helpful. What works best for you when you're getting this kind of information?
Right. Well, calling me later would be great. Okay. And I actually have a recorder, so if you could hand it to me, I think it's on the chair.
Sure.
That way I'll hear it and have it to reference.
Technology is offering many options to help patients with visual impairments manage their care. So be creative and flexible.
Yeah. So you just have to speak normally and it'll work.
Okay.
Record. No media.
Hi, Randy. It's Mary Ann Chaffee. I'm the nurse.
Although you may never have assisted someone who is visually impaired before, there is no need to feel uneasy about meeting or helping someone who can't see. With a helpful attitude, some common sense, and some assistance from the person that you are trying to help, it can be simple. Now you can feel more confident about giving that assistance. If you're not sure what to do, just ask, "How can I help you?" He or she will let you know if and how you can provide that assistance. But with the information that we've just shared and the techniques you've just learned, you'll know what to do. Remember, just ask, "How can I help you?"